Well, this is not good. Hey, it's Dr. John here again. I had a patient that I had to bring to surgery. It's a patient who has neuropathy and developed a wound to the top of his second toe. And essentially, this toe just constantly would break open into a wound. The bone was not exposed, luckily, but we've been dealing with this wound for such a long time, over 6 months. And realistically, fixing the toe where we could fuse it and make it straight was one option, although a lot longer recovery. But we also discussed just simply amputating the toe. And the patient knew that amputation recovery was much, much quicker. So here, after the patient is already anesthetized and asleep, I start making an incision to the base here. What I need to do is make sure that there's enough soft tissue to close the wound. And essentially I'm making almost like what we call a fish mouth incision. This will allow me to kind of bring the top part of the skin and the bottom part of the skin together. The incision is made straight down to bone. I'm attempting to locate the joint because essentially it's going to be a disarticulation of the toe joint. And if you know your anatomy, what I'm looking for is the metatarsal phalangeal joint. And essentially that is where we are going to disarticulate the toe to complete the amputation. Again, this is actually done with no tourniquet, just a little bit of epinephrine in the anesthetic that's given locally. But the goal of this amputation, as harsh as it may sound, is simply to allow for this patient to be able to wear a shoe, not worry about constant ulceration, which again, what can happen if this continues to ulcerate and get down to bone? Well, then the bone could get infected. The infection of the bone can further spread to the rest of the foot. A patient can eventually possibly lose their foot or even lower leg. And so this is a procedure to prevent that possibility. So again, I'm just getting to that disarticulation. We've got to dissect free a lot of the ligaments that are holding that base of the proximal phalanx, and boom, there we go. And we put that on the back table. And now we look at trying to dissect any remaining tendon tissue that is exposed to the surface. We just want to minimize any further risks of any other infection. So you can barely see the head of the second metatarsal there, shining with its cartilage. Again, at this stage, what I'm trying to do is just look at any tendinous structures. We'll next thoroughly rinse this wound out. And again, I got plenty of skin, plenty of tissue to work with. The last thing we want is tissue to be in a tensed closure. That's a recipe for an incision to rip open. So again, we're just flushing the wound thoroughly. And once this is flushed out, we'll suture this back up. And the patient really, the recovery for this is 2 weeks. So they're in a surgical shoe and bandaging for 2 weeks, and we're essentially waiting for this skin incision to heal. Once the incision's healed, this patient can go back into a regular shoe. And so this is a patient that, really was satisfied and happy to essentially have this procedure done and get back to normal life and not having to worry about constantly having an ulceration. As you notice, if you notice on the rest of his foot, he has other hammer toes, and he even has a little bit of a bunion there. But we're not trying to create a perfect foot on him. We're just trying to treat what is needed, and in this case, we're trying to minimize that constant re-ulceration of that second toe. And the patient will be very happy to be able to not have to worry about constantly coming in every other week to have wound care done. So I add a deep suture of a vicryl suture material just to kind of bring the soft tissue deeper and kind of closed in. And now I just want to make sure that we're getting the edges about as approximated, in the right spot as best as possible, because what we don't want is the skin edges to fold over on each other. And so that's why I'm just making sure I'm very careful to allow for proper alignment of this incision to be held together. Now, in case you're wondering, this is what it looks like afterwards. And we actually did his other foot as well, and the patient's very happy. Hope you enjoyed. Take care. We will see you next time.